Hello, and welcome. I am Dr. Zhang. Today, we're going to delve into a topic that's often on the minds of many cancer patients, that is, nutritional supplements. Nutritional supplements are widely used by individuals undergoing cancer treatment, often with the belief that they possess anticancer properties or can help alleviate treatment-related side effects. However, it's important to recognize that not all supplements are created equal, and their effects on cancer patients can vary significantly. As a medical professional, it's my responsibility to ensure that we base our decisions regarding supplements on solid evidence derived from clinical trials and scientific research. By doing so, we can better understand which supplements may be beneficial, which ones may be harmful, and how they may interact with conventional cancer treatments. Throughout this discussion, I'll be addressing some of the most commonly asked questions that arise regarding the use of supplements in cancer care. My aim is to provide you with reliable, evidence-based information to help guide your decisions and optimize your treatment outcomes.
Dr. Zhang, I was just diagnosed with stage 4 cancer, and I'm feeling so desperate. I visited a holistic practitioner, and they gave me so many supplements to take home. They said these supplements will detoxify my body, strengthen my immune system, protect against harmful side effects from chemotherapy due to their antioxidant properties, and reassured me that there are no harms because they're natural. Can you give me more guidance on how to deal with all these supplements?
Certainly, that's why we're here to have this discussion today. I understand it can be overwhelming, but once you have a basic and better understanding of supplements, it won't be too difficult to know which ones you need, which ones you don't, and when to use them.
Dr. Zhang, among all the supplements, what is the single most important one to take?
Vitamin D, specifically in the form of vitamin D3, is the most important supplement for all cancer patients, regardless of stages. It boosts the immune system, and has been clinically proven to kill more cancer cells, whether used with or without chemotherapy. Make sure you take the right dose. Your blood vitamin D level will dictate how much you need. Most people require 4,000 IU to 10,000 IU daily. Adjust your dosage according to your blood levels, monitor vitamin D every 3 months, aim for a target level of 75 to 100.
Dr. Zhang, what are other important supplements beside vitamin D which I should not miss?
Melatonin is the second important one. You should take it if you have active stage 4 cancer. It's optional to take melatonin or not if you have stage 3, 2, or 1 cancer. Confirmed benefits of 20 mg of melatonin use in many clinical studies show improvement in asthenia, nausea and vomiting, hypotension, and thrombocytopenia. Current studies clearly show that melatonin 20 mg improves executive function, enhances memory and recognition, reduces depressive symptoms, and enhances sleep quality.
Dr. Zhang, do you have any advice on the proper dose of melatonin?
For cancer patients, the recommended dose of melatonin is typically 20 mg at bedtime. I do not recommend any dose above 40 mg. I know some patients take hundreds of milligrams of melatonin, but I don't see good evidence for that.
Okay, I'm going to take melatonin 20 mg per night. However, my radiation oncologist and medical oncologist said that melatonin is an antioxidant, and I should avoid melatonin during my scheduled radiation and chemotherapy. What do you think?
It's essential to consider the advice of your radiation oncologist and medical oncologist, as they have expertise in managing your standard cancer treatment. While melatonin is indeed an antioxidant, and may theoretically interfere with the effectiveness of radiation and chemotherapy, the evidence on this is not conclusive. Additionally, melatonin used in high doses, such as 20 mg, can also act as a pro-oxidant. Some studies suggest that melatonin may enhance the effectiveness of cancer treatments and reduce their side effects. I typically only advise stopping melatonin during chemotherapy or radiation, if patients have early stages of cancer, such as stage 1, 2, or 3 cancer. For patients with stage 4 cancer, I may recommend continuing melatonin 20 mg during chemotherapy or radiation.
Okay, I understand I should take vitamin D and melatonin. Are there any supplements I should avoid in all circumstances?
Yes, I do have many concerns about several supplements, although they are prescribed by some holistic practitioners. My opinions are based on solid clinical trials and data, not merely theories. Do not take supplemental selenium, particularly if you have prostate cancer. Limit your vitamin E intake to either 50 or 200 IU, and use the gamma-T forms such as tocopherols and tocotrienols. Do not take NAC and acetyl L-cysteine or glutathione at all. Do not take CoQ10 if you are on statins as a repurposed cancer treatment. Also, do not use red yeast rice or Laetrile, amygdalin or vitamin B17.
I thought selenium is a good antioxidant, why can't I take it?
It is indeed a good antioxidant. However, large clinical trials have shown that selenium or vitamin E does not prevent cancer. In fact, contrary to expectations, they can make cancer more aggressive and grow faster. This has been demonstrated in prostate cancers, and it could be true for other cancers as well. As a precaution, I do not recommend using selenium or any vitamin E supplements exceeding 200 IU at all. Here, you see, data speaks louder than theory.
Okay, I got it, but what is wrong with NAC, N-acetyl L-cysteine, or glutathione? I think they are perfect antioxidants.
They are indeed potent antioxidants. They may help detoxify cancer cells of free radicals. However, it's crucial to understand that we actually need free radicals or pro-oxidants to kill cancer cells. So while NAC or glutathione may protect normal cells from damage, they can also inadvertently protect cancer cells from dying.
Dr. Zhang, that is a little bit scary. I heard CoQ10 can kill cancer cells. Why don't you want me to take it?
CoQ10 is indeed a key element in mitochondrial electron transfer chains. When used by itself, CoQ10 may possess anti-cancer activity. However, it does not make sense to use it alongside statin drugs. We use statin drugs in cancer patients as repurposed anti-cancer medicine. One of the mechanisms by which statin drugs work is to lower CoQ10 levels and slow down mitochondrial reactions. So if you supplement CoQ10, you may not get the full strength of the statin. Therefore, in most cases, I avoid recommending CoQ10 supplementation.
Talking about statin drugs, is red yeast rice a natural form of statin? If so, why don't you recommend a natural form of statin and ask me to take the drug instead?
You are absolutely right, the active ingredient in red yeast rice is identical to statin. Unfortunately, many red yeast products on the market contain too much statin, which could lead to liver failure due to inappropriate dosing. Additionally, we don't know the quality of each product and what safe doses are, since the FDA does not routinely monitor these products. I think the drug forms are more reliable and safer. At the end of the day, they are very close. So why take the risk with your liver when red yeast rice offers no advantage? Being natural does not equal being safe.
I agree. How about the story of Laetrile amygdalin or vitamin B17? I heard B17 is a cancer cure but suppressed by Big Pharma.
This is a little complicated. As you may know, Laetrile is promoted as an alternative cancer treatment. Laetrile is a man-made form of amygdalin, or B17, a plant substance found in some nuts, plants, and seeds of fruit, such as apricot. It contains cyanide, a poison. Believe it or not, many centuries-old traditional Chinese medicine formulas used to treat cancer contain apricot. In 1845, amygdalin was used as a cancer treatment in Russia, and in the 1920s in the United States. There's no doubt that amygdalin from apricot kernels induces apoptosis and causes cell cycle arrest in cancer cells. However, the clinical data is disappointing, showing no benefits. All the trials were done in the 1970s, and no recent trials have been conducted since the medical community does not have motivation to conduct more modern trials. Why apricots are used in traditional medicine for so many years if they are just a placebo? We do have many unanswered questions. However, I do not think the FDA suppressed the research. Part of the reason we do not have trials is a lack of funding, particularly lack of funding from investors or lack of interest from big pharmas. Why would big pharmas have interest in Laetrile, an old off-patent chemical? The good news is that some companies are now making nanoformulated Laetrile to try to resurrect it in modern times. Because it is basically a mitochondria poison and has a very narrow safety window, before we know much clinical data on the benefits or safety, we cannot recommend it. That being said, I think it is safe to consume whole apricot pits, although the right dose is unknown.
Okay, we've discussed quite a bit about the potential drawbacks of certain supplements. Dr. Zhang, do you have more encouraging results to share with me?
Certainly, I have a long list. Most cancer patients can try them, as they are generally safe and have been tested in clinical trials with the right doses, although not all of them show clinical benefits, like the strong evidence from vitamin D or melatonin we just mentioned in the beginning.
Can you share with me the list?
Yes, I'd love to share it. Here's the list: artemisinin, berberine, curcumin, DIM, EGCG, fucoidan, krill oil, polydatin, tiger cane, quercetin, resveratrol, and garcinia extract.
Dr. Zhang, I am on blood thinner. My doctor told me I cannot take curcumin or krill oil because they are too dangerous taken together.
Curcumin and krill oil do have anticoagulant properties, as many other natural supplements do. However, they are much weaker blood thinners, compared to prescription medications. If you don't have excessive bleeding risks, such as bleeding ulcers, brain cancer, or brain metastasis, you should be safe to take both blood thinners and these supplements, or you can lower your blood thinner dose to make it safer. Of course, you have to get permission from your treating physician to lower your blood thinner dose. If you do have a high risk of bleeding, then I recommend not taking blood thinners with curcumin or krill oil.
I am on metformin. Can I take berberine with metformin? I heard I don't have to take metformin if I take berberine since they are similar. Someone told me it is too dangerous to take both metformin and berberine because they will lower my blood sugar too low.
Yes, you can take both metformin and berberine. Although they work in a complementary manner, they are not the same. It is completely safe to take both based on clinical trials. Of course, you need to pay attention to your blood sugar levels to ensure they don't drop too low.
Dr. Zhang, can you tell me who should be cautious with DIM?
Yes, sure, I'm glad you asked that question, as the use of DIM can be tricky in hormone-related cancers, such as prostate cancer, cervical cancer, or breast cancer. Human data indicate that daily supplementation with DIM may benefit patients with castration-resistant prostate cancer by inhibiting the androgen receptor. However, studies are mixed on whether it exerts positive effects in women with cervical cancer or breast cancer. So, I do not use DIM in cervical or breast cancer, just to be safe. Of course, I may change my position on this if we have more clinical data in the future.
Dr. Zhang, do I have to take all of those supplements?
No, you don't have to take all of them. The essential ones are vitamin D and melatonin. The others are optional. You can stop any supplements if they give you nausea, stomachache, dizziness, or if you suspect they are causing liver injury or any other possible side effects. It's essential to listen to your body and adjust your supplement regimen accordingly.
Dr. Zhang, you mentioned liver injury, and that's my concern too. Can I take milk thistle to protect my liver or help my liver detoxify chemicals?
No, I do not recommend any supplement to protect the liver. Clinical trials indicate that milk thistle failed to show any beneficial changes on liver biopsy, although it may improve liver blood tests. Unfortunately, routine liver blood tests measure liver enzymes leaking into the blood, and the numbers have nothing to do with liver physiological function. Additionally, liver function tests are crucial for monitoring many drug side effects. Therefore, it's better not to artificially change liver function numbers with milk thistle. In simple terms, I do not think patients should take milk thistle.
Dr. Zhang, my oncologist does not want me to take supplements because I am on IV and oral chemotherapies, and he has lots of concerns about drug interactions.
Your doctor's concerns are understandable. Clinical research on interactions between supplements and chemotherapy is limited so far. To my best knowledge, EGCG is the most frequently cited supplement to decrease oral chemotherapy absorption. This is the same reason we do not recommend drinking tea with any pills. Therefore, I will not recommend EGCG with any cancer pills. Alternatively, space EGCG with cancer pills at least 4 hours apart if this is feasible. Grapefruit interferes with many cancer medicines, so no one recommends it. I should also point out that St. John's wort increases the P450 system, and aids in the clearance of many drugs, including cancer medicines, so I generally discourage the use of St. John's wort in cancer patients. Besides those, most supplements do not have significant interactions. Of course, if we or your doctor finds any potential interaction, we will modify the protocol, and ensure it is safe. This is a dynamic process, and we will maintain high vigilance on drug interactions.
Thank you, Dr. Zhang. We've covered lots of important questions so far. Can you put it in a nutshell?
Certainly, I know it's kind of overwhelming. First, everyone can take 2 basic supplements, melatonin and vitamin D3. Second, for those with stage 1, 2, or 3 cancers, and no active cancer after surgery, patients are taking supplements along with chemotherapy for cancer prevention. I recommend a selected number of supplements, such as artemisinin, berberine, curcumin, krill oil, melatonin, and vitamin D3, because they are proven to be safe. For those with stage 4 cancers and on palliative treatment, patients may consider incorporating a wider range of supplements for potential supportive benefits. These include artemisinin, berberine, curcumin, diindolylmethane, EGCG, green tea extract, fucoidan, krill oil, melatonin, quercetin, resveratrol, super-HCA Garcinia extract, and vitamin D3.
Dr. Zhang, thank you. Now I have a much clearer picture. Can you give me some guidance on the dosing?
Certainly. However, the dosing I provide is just a guideline, not the final doses. The doses are determined by a variety of clinical trials. Start with lower doses first, and slowly increase to the recommended doses over 1 or 2 weeks. Stop any suspected supplement that gives you side effects and notify your doctor. Here are the reference doses. Artemisinin, 100 mg, 2 capsules daily. Berberine 300 to 500 mg, take 1 capsule, 2 times daily. Curcumin in the brand of BCM 95, 2 capsules daily. DIM, diindolylmethane, 75 mg, 150 mg, or 225 mg, twice daily. EGCG green tea, 400 mg, take 1 capsule daily with a meal. A wide range from 200 mg twice daily to 1000 mg twice daily. Fucoidan, 500 mg to 4000 mg, twice daily with food. Krill oil, 1 to 4 grams by mouth daily. Melatonin, 20 mg capsules, 1 capsule at bedtime. Quercetin, 500 mg, take 1 capsule per day with meals. Resveratrol, 500 mg, take 1 capsule, 1 or 3 times daily. Super-HCA with Garcinia cambogia extract, take 1 capsule 3 times per day 30 to 60 minutes before meals. Vitamin D3, 4000 IU to 10,000 IU per day.
Dr. Zhang, my last question, what should I do with all the other supplements my holistic doctor gave to me, but you did not mention here? Should I stop them, or should I continue them?
It is ultimately up to you and your holistic doctor. However, if you have stage 1, 2, or 3 cancer, not stage 4, I recommend sticking to the supplements we discussed here and not adding more beyond the list we provided. If you have stage 4 cancer, you have the freedom to decide whether to take them or not. I do not have firm recommendations because I do not know much about the other supplements people are using, based on available clinical trial data. Without solid clinical data, I cannot recommend for or against them. I cannot justify the use of any supplement solely based on theories or animal studies. I hope you understand our limitations in this regard.
Thank you for tuning in. We hope Dr. Zhang answered most of your questions and added clarity to supplement use. Again, the data is limited, and be vigilant about side effects and interactions. It's essential to be transparent and inform all of your doctors about the supplements you are taking. Let us know if you have more questions.
The information provided here is for educational purposes only and should not be construed as medical advice. While we strive to provide accurate and up-to-date information, it is important to consult with a qualified healthcare professional before making any decisions regarding cancer treatment or supplement use. Each individual's medical needs and circumstances are unique, and what works for one person may not be appropriate for another. Always seek the guidance of a licensed healthcare provider for personalized medical advice and treatment recommendations tailored to your specific situation.